Gentlemen, let's talk candidly about something that changes for every man past the age of 50. It's the elephant in the room that no one wants to discuss openly, but everyone wonders about privately. Potency, stamina, and that certain confidence that comes with knowing your body will simply respond when you need it to. You might have noticed the process is slower now. Maybe the firmness isn't what it used to be. Perhaps you're experiencing unexpected urinary issues, or that nagging, chronic lower back pain has worsened. And like most men, you've probably accepted this as the inevitable price of getting older. But what if I told you that the decline you're experiencing isn't a life sentence written in stone by Father Time? What if the real culprit wasn't your age, but a simple mechanical bottleneck in your core anatomy that you've unknowingly neglected for decades? I'm talking about a specific, powerful pressure point on your body, a therapeutic nexus that, when activated for just 60 seconds a day, can fundamentally clear that bottleneck and reset your system. What if there was a simple, private act of self-care that could dramatically improve the arterial blood flow to your entire pelvic region, ensuring the spongy tissue responsible for firmness gets the volume it needs? Decompress the critical nerves that govern sensation and response, leading to a noticeable return of youthful sensitivity? Release deep, chronic tension in your core muscles, alleviating stiffness not just in the bedroom, but in your lower back and hips? I know, it sounds almost too simple to be true. You might be skeptical, thinking this is another bizarre, new age health fad. Please, hear me out. This specific spot, which we are going to locate together in detail, has been revered in traditional medicine systems for thousands of years as the meeting of yin, the epicenter of male vitality. And today, modern urology and physical therapy are finally providing the anatomical evidence for why this technique is so profoundly effective. I'm going to guide you through a complete, step-by-step protocol. I will show you the exact location of this powerful spot, sometimes called the $1,000,000 point. The precise 60-second massage technique that yields maximum circulatory and neurological benefit. The best natural oils that turn this simple massage into a deep, therapeutic treatment for inflammation and vascular health. This isn't about popping a pill, it's about taking command of your own physical destiny. It requires no expensive equipment, no awkward doctor visits, and just 1 minute of your time. This simple practice could be the missing piece in your health routine that restores your comfort, freedom, and confidence. So, before we dive into the deep anatomical truths, I have a quick request. If you are committed to finding natural, proactive solutions to better health, hit that like button right now. It helps this crucial information bypass the usual noise and reach more men who need it. And drop a comment below. Tell me, what's the single biggest misconception about male aging you want to dispel? Let's start the conversation and build a community. Let's be honest about the conversation men have, or more accurately, don't have about performance after 50. The cultural narrative is powerful and discouraging. Things slow down, things get weaker, and eventually you just accept it. Maybe you rely on a prescription as a quick fix, an emergency measure when you need it most. That acceptance is the biggest mistake we can make. It's the surrender that kills confidence long before the biology does. I'm here to tell you that the decline is almost never a switch that's been flipped by your 50th birthday. It's a slow-motion catastrophe, a mechanical and circulatory chokehold that builds up over years of modern living. Your problem isn't a sudden failure, it's a traffic jam at the most critical intersection in your body. When a man experiences a significant decline in erectile quality, consistency, or sensation, the root cause is a convergence of 3 mechanical issues, all centering on the very spot we are about to massage. Understanding these 3 points is key to believing in the power of this 1-minute fix. 1. The vascular culprit. Arterial stagnation and stiffness. Biologically explained, the rusty plumbing analogy. Think of an erection as 90% blood flow. The penile tissue is like a sponge that must rapidly fill with blood, and that blood is delivered by the internal pudendal arteries. These arteries run straight through the pelvis. Years of Western diet, inflammation, high stress, and most critically, sitting for long periods cause the inner lining of these vessels, the endothelium, to stiffen. They become less flexible and less responsive to the signals that tell them to dilate. Practically, when you're constantly sitting, gravity and pressure compress these vessels. This slows the flow, leading to stagnant blood that's lower in oxygen and higher in metabolic waste. It's like having rusty plumbing, The water pressure is low, and the water quality is poor. Emotionally, this leads to a loss of spontaneity. The system takes longer to prime because the flow isn't instant. This delay creates anxiety, which further constricts blood vessels, creating a vicious cycle of performance panic. 2. The muscular culprit, the pelvic floor chokehold, hypertonicity. Biologically explained, the chronic tension paradox. The pelvic floor muscles, PFMs, are a diamond-shaped sling of muscles controlling everything below the belt, bladder, bowel, and sexual function. The paradox of the modern man is that his PFMs are often tight and weak at the same time. They are constantly tensed, hypertonic, due to stress, posture, and clenching, but they lack the endurance or strength for proper function. Practically, imagine holding a rubber band stretched tight for 24 hours a day. It's tight, but it has no snap left. This chronic tension is physically squeezing the major blood vessels and nerves that run through the pelvic region. It's literally choking off the supply line just as the signal arrives. Emotionally, this is a source of subtle, constant discomfort and tension. It reduces your body's ability to enter the rest and digest, parasympathetic state, which is the necessary physiological foundation for sexual arousal. You can't be stressed, clenched, and erect simultaneously. 3. The neurological culprit, faulty wiring and compression. Biologically explained, the garbled signal. The pudendal nerve is the superhighway for sensation and the go signal for the erectile tissues. This nerve, which originates in the lower spine, runs right through the muscular structures of the pelvic floor. When the muscles are hypertonic tight, they often pinch, compress, or irritate this crucial nerve. Practically, think of a compressed nerve as faulty wiring. The signal gets garbled, slow, or weak. The result is a dulling of sensation and a delayed or incomplete physical response. Emotionally, loss of sensitivity is often the first, most subtle sign of decline, but it's devastating to confidence. You feel disconnected from your own body, making it harder to feel the signals and harder to fully engage in intimate moments. The bottom line: your vitality is not gone. It is trapped behind this mechanical bottleneck of stiff arteries, tight muscles, and compressed nerves. The spot we are about to target is the release valve for all three of these systems simultaneously. That is the power of the 1-minute massage. Before we get to the how, let me properly introduce myself and share my philosophy. My name is Dr. Nerita, and for the past 12 years, my practice in urology hasn't just been about surgery and prescriptions. It has been about finding foundational, holistic, and sustainable ways for men to maintain their total health, physical, sexual, and emotional. I've had thousands of men sit across from me, often feeling frustrated and isolated, telling me, "Doctor, I don't feel like myself anymore." They are tired of the quick fix approach that doesn't address the underlying issue. They are tired of feeling like a collection of broken parts. My guiding philosophy is this: you are not a broken machine. You are a magnificent system that needs proper, consistent maintenance. The decline you're fighting isn't a mystery. It's an anatomical issue that requires an anatomical solution. My work has led me to study deeply the principles of Eastern medicine and physical therapy because they recognize what Western medicine often forgets. The body works as a single, interconnected unit. The tightness in your hip flexors affects your lower back, and the tension in your lower back directly affects your pelvic floor, and yes, your potency. This massage technique is not something I invented. It's an ancient wisdom now validated by modern physiology. I recommend it to my patients not as a replacement for comprehensive care, but as a cornerstone of daily preventative maintenance. It's about empowering you to be the co-pilot of your own health journey. We are moving away from passive dependency, waiting for a problem to happen, and relying on a pill to patch it, to proactive mastery, using simple daily actions to prevent the problem in the first place. It's about investing 1 minute a day to ensure decades of future comfort and confidence. So, let's locate this crucial command center and learn how to use it. We've established the why, the mechanical bottlenecks of circulation, tension, and nerve compression. Now for the how, the execution. But before I show you the exact location and technique, we must address the 5 biggest mistakes men make when trying self-care practices like this. Avoiding these pitfalls is the difference between quitting after 3 days and seeing life-changing results after 3 weeks. Mistake 1: aggression over finesse. Too much, too hard, too soon. The error. Treating this delicate area like a deep tissue sports massage on a hamstring, men are conditioned to think more pressure equals more results. Biologically explained, the perineal area is an intersection of delicate nerves and highly vascularized tissue. Aggressive, deep pressure doesn't break up tension. It can cause inflammation, irritate the pudendal nerve further, and create microtrauma in the tissue. This inflammation actually worsens the circulatory chokehold you are trying to fix. Practically explained, if you are sore the next day, if you feel bruised, or if you feel a radiating, unpleasant sensation, you have gone too hard. The correct pressure is the ripe tomato check, firm enough to slightly indent the tissue, but gentle enough that it feels therapeutic and slightly tender, never painful. Emotionally explained, pain leads to avoidance. If the practice is uncomfortable, your brain will label it as a chore or a punishment, and you will quit. We are aiming for a sense of relaxed, intentional self-care, not a self-inflicted medical procedure. Ease up. Consistency at a gentle pressure beats intensity every time.